Good afternoon. Welcome to the daily briefing at the St. Clair County EMA office, where I'm joined with Chairman Mark Kern and Sam Behrman from the Health Department. Today we're changing things up just for a little bit. We got a special guest with us, Mr. Mike McManus, the CEO President of BJC, is with us today. Mike, welcome.
Thank you, Herb.
Hi, Mike. Thanks for being on today. So the numbers today that we're going to talk about in a little bit, but just to show what those are, 106 patients currently in our St. Clair County hospitals, 10 on ventilators, all with COVID. Tell us what the status is right now that you're seeing at Memorial.
We have been about 50 to 60 COVID positive patients at our hospitals for the last week or more. We are having COVID positive patients in both our campuses, the Belleville and Shiloh campus, and we have had to open up another COVID unit in the last 2 weeks as a result of the increase in volume.
So with all of the talk about beds, let's go into a COVID-19 patient. Requires more care than an average patient, isn't that right?
They do. Although things have improved since March when this began, and physicians have learned more and more. The length of stay has slightly reduced from it used to be a few more days. It's a little less. We have some new drugs like remdesivir that can help reduce the length of stay, and they're shown to be some beneficial. There was a new monoclonal antibody infusion therapy that was approved, and we're working to get that implemented. Not yet, but it will be soon in our hospital. We'll be the Illinois distribution site for BJC Health System. And so things have improved. The issue right now, Mark, is our ICUs are filling up, and honestly, COVID is 1/3 of our patient volume right now in our hospital. It's 1/3 of our patient volume, and they are very intensive to take care of. Even though length of stay is decreased, they take a lot of care, and because the positivity rate, the number of people that are coming down with COVID has increased since about middle of October, and is going up significantly, as we've all seen the last few weeks. Used to be state Illinois, you would report 3,000-4,000 cases statewide. You're seeing 10, 12, 14,000 cases statewide. No different for St. Clair County and the St. Louis metro area, seeing those increases. And it's a numbers game because more people are coming down with COVID, more people are ending up in the hospital, more of those people that are ending up in the hospital are ending up in our ICU, and more of those people are needing ventilators and things like that. So we're at 1/3 of our patient population's COVID right now. It's been that way for 2 weeks.
And so there was an article in the Atlantic today that said, a normal person that goes in ICU, they're in there 1/3 the length of time as a COVID patient. So it's not only that you've got big numbers in ICU, you can't get rid of them. I mean, they are there, and they're there for a longer term than a normal patient. You got to get them. It takes longer to get them to a point where you can move them to another place.
You're correct. Those folks are in ICU for a reason because they're very, very sick. They're very sick, and it's it's going to be. I'm afraid it's going to potentially get worse. It will get worse as we've seen the numbers go up. The St. Louis region is 800-900 COVID patients right now. We project that to grow through to December in the projections. Memorial, we potentially could see double the COVID volume that we see today by the second, third week of December.
How equipped are you, both personnel-wise and infrastructure-wise, to handle a double in the amount of patients that you have now? That's almost a Herculean task.
We're doing surge planning right now. and we're all engaged. All BJC hospitals are actively engaged in surge planning. We're looking at what we can do to address that, from equipment side, bedside, intensive care, finding alternate sites potentially for intensive care, and staffing, and how we are going to support our frontline nursing staff who has patient assignments. There's no doubt they will have to be extended. There is no doubt in terms of their assignments. There's no doubt we'll have to provide some support and things like that. We are likely going to have to look at, first of all, I suspect our surge planning, if we get double the patient volume, we will be able to stretch to a point, but it will still be insufficient, potentially insufficient to address that kind of volume. So we are looking at things like further reducing elective surgical cases. We will do that. We will no longer be able to accept transfers from outlying hospitals and rural hospitals. And this isn't just Memorial, this would be St. Louis region wide. And because we don't have a bed to take those people. So this is very concerning. And this is something that I can't stress enough to folks. I'll kind of get to the punchline here, Mark. We still have time to turn that curve. We need to stop debating whether it works or doesn't work, or show me the science or things like that. And we need to all do our part to social distancing, masking, hand washing, refraining from activities that can spread. We can still impact that projection for December. It's not too late, but I've seen the numbers every week that goes by that we don't do that and don't do something to that rate. These projections become more and more real.
And it's imperative that everyone does those things. It's really
Everyone.
something we've got to get, substantial compliance. And right now, I'm not sure that we're at those numbers that we need. Obviously, when we see the rise in COVID cases, we haven't reached a level where we have enough compliance. Were we ever at this? We've been talking now for 255 days. Have we ever been at a point like we are now?
No, we far exceeded April and May. We far exceeded the spring. We blew past that 2-3 weeks ago, and we are at a number that I haven't seen yet. I haven't seen, and this is St. Louis region wide, and it's affecting every hospital. Every hospital is strained now. Where in April and May, it was maybe targeted at certain hospitals that had more volume, Memorial, Orange Jewish, et cetera. It's every hospital now, whether it's St. Charles County, Madison County, St. Clair County, St. Louis County, you name it. And that's one of the challenges.
So, Mike, the message is that the hospitals can only do so much. They can only handle so much. They need the public to embrace the wearing of the masks and the washing of the hands and watching the social distance, staying out of crowds. Don't go out unless you have to in order to get this number turned. Is that the message that we need to be getting out?
Yes, and St. Louis Pandemic Task Force, has been talking about this for several weeks. I think Dr. Garza has raised these concerns, and I agree 100%. This is serious. This is serious now. It was serious before, but now it's very, very, very serious. But we can still turn the curve a little bit so that we're not at a point where hospitals could potentially be beyond their breaking point. So I would encourage every person to do their part. And if not, not for me, for the sake of our folks who are taking care of all these patients. Our folks are stretched to the max, and they may be stretched even further. And think about your friends and neighbors in healthcare, please.
And they are, and let's talk about our friends and neighbors in healthcare. They're worn out, right?
Mm-hmm. Yes.
But yet they have this drive that got them into the profession to start with that's going to get them through this, but it's got to be exceedingly difficult.
Yes, and it is, and I can only imagine. I'll give you a little vignette that I shared here at the hospital. I think I was perhaps in COVID denial for a few weeks there. I saw the numbers going up myself. I'm in the business, and I couldn't help but go through, oh no, do we have to do this again? Do I have the energy to go through this again? My goodness, if I went through that, I can't imagine what a frontline nurse in an ICU at our hospital is going through every day. And we had to give ourselves a little pep talk. And the reason I share that is it is a grind, but I take comfort in, I think more of this is behind us than there is ahead of us, Mark, in that I don't think we'll be at this for 8 or 9 more months because there's promising vaccines on the horizon. But the hill right in front of us, is extremely steep. The hill for the next 4 weeks, 6 weeks is extremely steep. If we can get past that, I think there's light.
And Mike, when we talk about the capacity issue, which is really what we're dealing with, whether it's human capital, whether it's beds, decisions they talk about, and you haven't talked about it, but when I watch television, I see that the big fear is that decisions are going to have to be made as to who gets a ventilator, who gets a bed. We want to stay out of that untenable situation where those decisions have to be made. But we're at a point where that's possible. Is that right?
Worst case scenario could be possible. Where we of course we want to avoid that, and we will do everything we can to avoid that. But I'm no epidemiologist, but if things keep going on the curve that we're facing, those could be some decisions and conversations that would have to be had.
And just to go along with another tough situation, what is the policy now for family members to be with someone who has COVID? That if they are in the final stages of life, can family come and visit, or is that still restricted?
Well, we'll allow visitation in final stages of life. A lot of times it will be outside the room, though, via like a video call or via phone and things like that. We still have some restrictions in terms of COVID positive patients and being actually in the room. And some hospitals are going to no visitor restrictions entirely also, except in certain rare circumstances. We haven't went to that yet, but I know some places are considering it or have done that.
Mike, you're a great friend of this effort of Team St. Clair. Why don't you give us a final message here that people can take with them and hopefully can pass on, because you're there every day. You're in the middle of this. What should we take away from this?
We are. This is unprecedented. We haven't been at this stage for the last 9 months. We are planning for the worst, given the projections we're looking at. Hopefully that doesn't materialize, and it's not too late to impact that, is how I would leave it.
Okay, Herb?
One question, Mike, and we talk a lot, and we get a lot of questions about the beds that are available. And we try to make our listeners understand that when we're talking about the shortage of beds, it's not always that you've got the physical bed there, but the staffing is a major concern. Can you kind of just expand on that a little bit so our viewers that get them mixed up will understand better?
Sure. In normal circumstances, meaning a non-COVID situation, usually the issue that you encounter in a hospital is staffing rather than beds. There's usually an ample supply of beds, and and especially in areas that are basically hard to recruit because of nursing shortages, whether it's critical care or emergency room, things like that. Usually that's the situation more often than not. So when folks non-COVID time say we don't have a bed, it means we don't have sufficient staff to offer the type of patient care that we want to offer. Okay. In this circumstance, though, it's a little bit of both, Herb, I would say. If we hit the numbers that we're looking at, and heaven forbid we do, we will be at both. We will be lacking intensive care unit beds, and we'll have to go to alternate sites in the hospital or med-surg beds and open up areas we haven't opened before. And we won't have the staff to take care of it. Now, in priority order, I would say staffing is the number one issue. Beds are the number two issue. in this situation. But in the COVID scenarios, both of them come into play.
Right. Because as we keep telling our listeners every day, it's just not the COVID patients that you have to be prepared for. It's those car accidents, the heart attacks. You have to make sure you have bed available for them also.
Yes. And an interesting statistic I will share with respect to that, because knock on wood, we've had a mild flu season so far. St. Louis region-wide, 7% of emergency department visits are COVID related. 1% of emergency department visits are flu symptom related right now.
Well, I'm glad you brought that up, because that's been a big topic on our page. People saying it's, the flu has more impact, so I'm glad you really brought that up. Mike, as the chairman said, we really appreciate your partnership with Team St. Clair. You and Patty Fisher from HSHS, who will join us tomorrow. She was going to be here today, but she had another engagement, because I think it's important that the citizens see that the hospitals are working together for this crisis. So we really appreciate you taking time today.
My pleasure, and I appreciate you all too, and everything you're doing at the county to get the word out, to support us, to do everything we can for 255 days. It's heroic work. Thank you, Herb.
Fine. Thank you very much.
Thank you, Mike, very much.
Well, Chairman, I think that pretty well adds a lot of light onto the hospital situation, which now I think that's at the forefront. So,
And tomorrow we'll be hearing from St. Elizabeth's Hospital and the HSHS system. So I think they have a similar story.
yes.
But it's going to be interesting to get that perspective. And this is serious stuff.
It is, and I think the story that when we talked with them this morning via video is that they're working together for the common good of the whole region. And like I said, I think Patty will really shine the light as Mike has. So we're going to go ahead and get into the numbers today because, Sam, they are a little bit better.
They are a little better. While today is a better day, we've seen some ups and downs lately. So please, keep going with our 3 W's. And to tie in what Mike said, that's why it's so important when we have our contact tracers call someone that is positive or that has been exposed to a positive to be as open and to recall as many details as possible. We want to isolate those that are sick and to quarantine those that have been exposed to hopefully prevent the spread to someone else that could potentially wind up in the hospital. That's why it's so important to be open and honest with your contact tracers and to follow all of the guidelines that they are giving you. So as of today, 146,963 St. Clair County residents have been tested, which is an increase of 2,415, which I think is one of our highest days so far. And we have 13,340 positives, which is an increase of 263 from yesterday. And that does include both males and females from under the age of 1 up to their 90s. Today, our daily county positivity rate is 10.9%. And we are at 133,623 negative test results. Unfortunately, we are announcing an additional death. That was a male in his 70s who had unknown health conditions. And as always, our sympathies go out to their family. For those who have completed the IDPH required 10-day isolation period, we are at 10,994. For state totals, 9,892,981 have been tested, with 664,620 positive test results, which is an increase of 8,322 from yesterday. And for deaths, the state is reporting 11,552, which is an increase of 47 from yesterday. For regional hospitalization numbers, currently we have 106 patients that are admitted due to COVID-related reasons, and 10 of them are on ventilators. Regionally, we have 252 patients that are admitted due to COVID-related reasons, and 23 of them are on ventilators. For our congregate living facilities that are currently or previously in outbreak status, these are cumulative numbers, and we will only announce any facilities that have had any changes. Cambridge House of O'Fallon has 14 cases and no deaths, and that is an increase of 5 cases. Caseyville Nursing and Rehab has 73 cases and 2 deaths, and that is an increase of 8 cases. And Integrity Healthcare of Belleville has 23 cases and no deaths, and that is an increase of 6 cases for that facility. And I will turn it over to Chairman Kern for his update.
Thank you, Sam. We'll go into the zip code report at this time. These are the COVID positive changes in these particular St. Clair County zip codes. And while the numbers, the percentage may look a little better, we have increases in all but 2 zip codes today. So the spread is generally throughout the community. In 62059, we go up 1 to 23. 62201 up 4 to 353. 62203 up 6 to 367. 62204 up 6 to 221. 62205 up 10 to 347. 62206 up 12 to 659. 62207 up 5 to 359. 62208 up 9 to 773. 62220 up 14 to 960. 62221 up 21 to 1,246. 62223 up 7 to 841. 62225 up 2 to 69. 62226 up 15 to 1,417. 62232 up 5 to 398. 62239 up 1 to 187. 62240 up 1 to 70. 62243 up 5 to 273. 62254 up 3 to 433. 62258 up 4 to 477. 62260 up 2 to 304. 62264 up 3 to 144. 62269 up 30 today to 1,310. 62269, for all those who are students of the numbers out there, is rapidly gaining ground and is now the number 2 zip code in the county. It wasn't always that, and they are rapidly gaining on the 62226 zip code. So 62269 up 30 today to 1,310. 62282 is up 1 to 27. 62285 up 1 to 271, and 62289 up 1 to 20. Daily county positivity, 10.9% today, a better number, but we had 2,415 people tested, so 263 of those were still positive. It's still a huge number. That brings our 7-day rolling average to 13.1%. Regional positivity, this is how the state has calculated our positivity in our region, is at 14.3%. The counties in that region and their makeups: Bond County, 1% today. Clinton County, 20.9%. Madison County, 13.5%. Monroe County, 22.3%. Randolph County, 14.3% positive. St. Clair County, 9.2%, and Washington County, 18% positivity rate. So the region still having issues. We're at 14.3%. Our 7-day rolling average in the county at 13.1, headed in the right direction. But I think, Herb, we listened to what Mike McManus said. With Thanksgiving just a few days away, if this many people that have COVID are out there in the general public, we really worry what the spike might be after Thanksgiving. We saw a big spike at every holiday, after every holiday, and we're hoping that people might be listening and deciding that they're going to keep their gatherings amongst those in their household, and that when they go out, they're going to wear their masks and wash their hands and watch the social distance. Stay out of places that you shouldn't be in, that the executive order has ordered closed. If those places are still open, I think it's imperative that you remember that they weren't a part of trying to slow the spread of COVID. And once this is over, if they don't care much about the health and safety of the community enough to follow the law, then perhaps you need to think about that when deciding who to go back to after this is over.
Well, and we got some calls last night that there was a couple of establishments that have made that decision that they were shutting down because, you know, they're realizing that getting those large crowds together in those enclosed venues is not the best benefit for people's safety. Sam, you had some testing sites?
I do.
Forgot?
Both on tomorrow, which is Tuesday, November 24th, and Wednesday, the 25th, we have testing at Southwestern Illinois College from 8 a.m. to 4 p.m. both days. And I would like to give people the insight, since we are seeing increased testing, we are also seeing increased turnaround time. Please be patient with all of the labs that are processing these results. They are working as quickly as they can to process those to you, get those to us as a health department if they were a health department site, or for those facilities to give you a call with your test results. So please be patient. The labs are working as hard as they can to get those results out in timely manner.
And Chairman, another number we talk about is under the age of 40, 127 people that tested under the age of 40. So again, it just shows that the spread is everywhere amongst all the age groups. And so as you said, with Thanksgiving coming up, we've definitely got to be careful, keep that celebration. As I said yesterday, we all think about that traditional meal. And as I said yesterday, there were some people the other night that said, well, yeah, but you know, it's our tradition, it's our history. We always get the family and friends together. But just remember, if you do, it's a gamble, because that may be the last time you get together with one of those loved ones, because this thing just just expands.
And early on, it was the elderly that were greatly impacted by this. You know, how often now are we hearing about children under the age of 1 and you know, in the early stages of their life contracting COVID. And while we're working on, the symptoms that exist with COVID, we're hearing about long-term ramifications of this virus. That there are people who have recovered that still have symptoms of strong headaches or aches that they just can't get rid of, and they're worried that it may be something that's going to be around for the rest of their lives. So it isn't that everyone is completely recovering. Many people are seeing that they're going to have problems throughout their life because of this virus, and that's something that if you don't get it, you won't have that issue. And next Thanksgiving, when we have our vaccine and we're all back to a point where we can live our lives as we did before all this hit our shores, we're going to be able to move back into our lives. But those who have those long-term effects are going to have that forever.
Exactly. And before we go, I just want to remind you, speaking of those holidays, the Thanksgiving especially, as we've been saying, you've got to take that extra caution. Tomorrow, as we said, Patty Fisher, the CEO, president of HSHS, will be with us because we think it's another important message that you need to hear, that we are concerned about the hospital overload, and please share it out. We'll be back with Cindy and Daisy in a few moments to translate this into our Spanish communities. But before you do, we got a little video we want to show you, and if you would, Team St. Clair, please share this out, because I think it kind of helps get the message out of what we're talking about for this Thanksgiving holiday coming up. We'll be back tomorrow with day 256. Have a good evening.
Meet Jeff. Jeff is returning home to have Thanksgiving with his family. Unbeknownst to him or his family, Jeff is an asymptomatic carrier of COVID-19, meaning he has shown no signs that he has this deadly virus. Jeff spends most of his Thanksgiving day at home with his parents and sister, enjoying a Thanksgiving feast. After dinner, Jeff and his sister decide to go to their grandparents' house for dessert. Several other family members have come over to enjoy Grandma's famous pie. On Saturday, Jeff starts displaying symptoms of COVID-19, including a fever. He goes to get tested and finds out that he is positive and a carrier. Meanwhile, Jeff's grandfather starts also feeling ill. Eventually, he would have to be transported to the hospital because he's unable to breathe properly. Because of his close proximity to all of his family members 48 hours prior to the onset of symptoms, they must all now quarantine for 14 days. Jeff also now has to isolate himself for 10 days, and Grandpa remains in the hospital. We would like to remind you that COVID-19 is still infecting our community at an astronomical rate and taking lives each and every day. It's so very important to keep our gatherings small and only celebrate with those within our own family units. While these decisions can be difficult, if we work together, we can stop the spread of COVID-19. Wear your mask, wash your hands, and watch your distance.